In this module, we'll be talking about the appearance of the median nerve on the ultrasound. Upon completion of this module, the student will be able to identify the median nerve at the location of the carpal tunnel and pronator quadratus, will be able to describe the basic course of the median nerve and tissue it innervates, and they will be able to distinguish between a normal median nerve and one with a possible pathology. So now we're going to go over the median nerve map, and it's important to understand the course of the nerve because it could get compressed anywhere along this course, not just a carpal tunnel. So the median nerve originates from roots C6 to T1, and then it's formed by the contributions from the medial and lateral cord of the brachial plexus. It passes anterior to the axillary artery and lateral to the brachial artery. And then it passes under the ligament of Strutters, which is a fibrous band from the tip of a supracondylar process arising from the distal humerus to the medial epicondyle of the humerus. It switches to medial in the cubital fossa, and then it passes between the two heads of the pronator teres. And then it goes through the sublimus bridge, which is a fibrotendinous arcade that represents the origin of the flexor digitorum superficialis. It gives off the anterior interosseous nerve, which innervate the muscle in the anterior compartment of the forearm. Then it gives off the palmar cutaneous branch, which does not pass under the carpal tunnel. It passes superficial to it. It goes through the carpal tunnel, and then it innervates the thenar muscles of the hand. So an overview of the median nerve. In the transverse view, the median nerve will appear hypoechoic, which are dark spots, embedded in hyperechoic, which are bright epineurium background. It appears relatively hypoechoic in the carpal tunnel and relatively hyperechoic in the forearm. And the median nerve is compressible. It is located superficially in the carpal tunnel. The median nerve distal to the carpal tunnel innervates the first and second lumbricals and thenar muscles, so that would be the motor branch. And then sensory, it will innervate the skin over the radial 2/3 of the palm and the first 3.5 digits.
So we're going to look at a side-by-side comparison of the drawing of the carpal tunnel and the ultrasound image of the carpal tunnel. Again, the median nerve is going to be superficial in the tunnel, right here, and it's going to be just deep to the flexor retinaculum. You are going to find that it is more hypoechoic inside the carpal tunnel, and you can see kind of around the nerve that there's a hyperechoic border surrounding it. It's going to be more towards the scaphoid, so you can use that to orient yourself, the pisiform and the scaphoid, as well as the flexor retinaculum and some of the other tendons and structures that you learned about in the previous module. Remember that when you are adjusting the focus, you want the arrowhead so that it is at the level or the correct depth of the median nerve when viewing it on ultrasound. This will make sure that there are no artifacts when you're looking at it, and you can accurately measure around the correct borders. I'm going to give you guys a couple of seconds to look at these two images. These are both additional images on ultrasound of the median nerve at the carpal tunnel. Here are your bones, here and there, and this one's a little bit harder to see. The median nerve is labeled in both, and this one is more hypoechoic, but again, it's in relation to the other tissues. So you have the flexor retinaculum, just superficial to it, and then the other tendons that are in the carpal tunnel. Here you have an ultrasound image of the median nerve at the pronator quadratus. You have the flexor digitorum superficialis and the profundus, and then the pronator quadratus, that's the deepest part of the image. So the median nerve is going to move from superficial and get deeper in the forearm, and you see that it is more hyperechoic than in the carpal tunnel. I'm going to give you a few seconds to look at these images, but these are more ultrasound images of the median nerve at the pronator quadratus. The median nerve is labeled, but I'll point them out right here, right here. Again, it's more hyperechoic, and it's almost encased inside of the tendons. And then deep to everything is the pronator quadratus, right here. I'm going to play this video for you guys of the ultrasound transducer moving from the carpal tunnel to the pronator quadratus. I want you to really focus on the median nerve in this video and notice that it moves from superficial to deep as the video moves proximally, and it becomes more hyperechoic as it moves proximally as well. So see it moving. It's more hyperechoic. And then there it is at the pronator quadratus. I'm going to play that one more time. It's dipping down, becoming more hyperechoic, and there it is. Now we're going to look at the appearance of the median nerve in a patient with carpal tunnel syndrome. This is from one of our subjects, and you can see here's the median nerve at the carpal tunnel, and here it is at the pronator quadratus. So just thinking back to all of the pictures that you've seen so far, you can already see that the cross-sectional area is greater in both the carpal tunnel and the pronator quadratus. And you can see that it's almost half the size going from the carpal tunnel to the pronator quadratus. So there's a huge difference in that cross-sectional area. And the side of the maximum compression, the nerve can get flattened, and above this area it can get swollen due to the increased endoneural fluid and localized edema. I just want you to really look at the big cross-sectional area and the difference between the two in both of these images. Here you guys have some references. And now it is time to check your understanding. So you can go to the quiz tab on the website and take the Module 6 quiz before you move on to Module 7. Thank you very much.